The tummy, the peritoneal cavity, is where your bowels are kept, your liver, your spleen, and also as a woman where your uterus, your tubes, and your ovaries. And within that is 24 feet of muscular tubing, and that's what your bowel is from the top to the bottom. And that tubing is meant to move along with a thing called peristalsis. It's a muscular tube that's meant to move along all day long, rooting from the top to the bottom. The most common problem we get with the bowel is where that nice rhythm is lost, either through lack of exercise, diet, or anxiety, stress. And what happens is the muscle goes into spasm instead of its nice rhythm. And the classic sign is that we get pain down here, where the large bowel goes into intense spasm. The fact that it's simply a spasm does not stop it being an incredibly painful episode, but fortunately it's not associated with serious disease. It's usually associated, as I say, with eating the wrong foods or not enough exercise or just getting a bit uptight more than we need to. So that is by far and away the most common problem. There are other things that, of course, that can happen in the bowel. You can get problems with the stomach, ulcers. Previously, we thought that it was excessive acid production that led you to have stomach ulcers. And for years, we would try and reduce the amount of acid as the only way of solving the problem. In the last 20 years, of course, we found out that there's this little bug called Helicobacter pylori, which actually leads to the problem. And as often with changes in medicine, when it was first pointed out that there was this little bug causing the problem with ulcers, it wasn't believed. And it took some time for everyone to realize that the treatment for an ulcer was actually an antibiotic, rather than trying to stop all acid production. The other common problems that you can get in the bowel is a thing called inflammatory bowel disease, which is a condition where, for reasons we can't always explain, we create antibodies which attack our own bowel. The two common conditions are called Crohn's disease and ulcerative colitis. And they usually don't present with the kind of cramping pain, typically. They often present with a change in the bowel habit, often diarrhea, weight loss, and conditions such as that. Bowel cancer is a very common cancer, again, particularly with aging, and again presents with a change in bowel habit, often with the loss of blood from the bowel, is often the first clue as to the fact that there's something gone wrong in the bowel. And typically a disease that affects older people, certainly as you go from 50 years on. A colonoscopy allows you to look up at the large bowel and allows you to assess whether there's any precancerous changes, because nearly all bowel cancers, large bowel cancers, start off as a little polyp, a little growth, which then eventually grows into a cancer. So by looking at the colon and having a look inside, you can often spot these little polyps and remove them before they turn nasty. So that's something that everyone from the age of 50 on should consider having. The other big organ that's vital in our peritoneal cavity in our tummy is the liver. The liver is responsible for digesting and breaking down all our food, putting it to good use. It digests and breaks down all the different things that we take, from paracetamol to alcohol. It's essential for sorting out a lot of the waste problems of the body. It recycles the blood. It does many, many different things. It's an amazing organ. And it can get problems typically with inflammation, infection, hepatitis. And we've got hepatitis A, B, C. And A is often picked up from food, and it's fortunately a short-lived disease. Hepatitis B, sadly, can become a chronic illness, as can hepatitis C. The classic sign of hepatitis is being jaundiced or turning yellow, because we're unable to recycle our red blood cells quickly enough. So we start to turn yellow, and that's often the sign that our liver is inflamed. We can get liver tumours, again, fortunately uncommon. And the other problem with the liver is that the gallbladder, which is attached to the part of the liver, can develop stones and can cause problems with pain and digestion. The bowel, of course, is the way we get rid of solid waste from our bodies, but we also get rid of liquid waste through our kidneys. Our kidneys have two functions. One is to help us excrete the liquid waste that we can't or we need to excrete separately to the bowel, and it also is very important for keeping control of our blood pressure. The kidneys can get infection, they can get tumours, and of course they can get stones. And stones are effectively where you get sludge, where some of the excreted calcium oxalate, the crystals, because of dehydration or dryness, they can form into coalesce into small stones, which can be very painful when you have to try and pass them, because as they pass from the tube from the kidneys to the bladder, they will cause irritation, and again they'll cause that spasm that we talked about in the bowel, but they'll get it in the tube, the ureter, the tube from the kidney to the bladder, and again that spasm can be very intense and very, very, very painful. The bladder can get infection by far and away the most common problem, and it's more common in women than in men because the tube to the outside is shorter in a woman. Bladder tumours can also occur again, particularly as we get older, and they're the most common problems that we see with the kidneys. So if you have pain passing urine, blood passing urine, then we think of infection or possibly stones, especially if the pain is higher up. You need to see a doctor.